The Year of the Nurse is a great opportunity to raise public awareness of nursing and nurses' commitment to those they serve. And there's no better way than with a story of their unique journey.
Most of the time, you want to make an impact on their life, but in most ways, they're the ones making an impact on yours.
Just for a person that is in a really difficult time, they're even sick, they're very vulnerable, you're just there to listen to them, maybe to hug them, to laugh with them, to cry with them. So it's just being there for somebody that really needs help.
Seeing people recover, it gives me a sense of satisfaction, that I did something today, did something great today.
I think critical care has always been my passion. I feel like you really can change the trajectory of a patient's life, and it gives you the responsibility of making, critical decision-making skills, working really closely with all entities that are involved in the hospital, and it really makes me go home and feel like I've made a difference.
And I know I wanted to be a nurse because one day my dad was in the hospital, and I see those nurses taking care of him, and I said one day when I grow up I wanted to be like them too.
I do a lot of teaching with our nurses, and I mentor, and it's kind of like pay it forward type of thing. Someone took a lot of care in helping me out when I first got started, and I'm just trying to do that with the younger generation.
Best feeling is being able to calm someone down and help them when they're very scared and they don't understand what's going on, and help them understand what's going on with their body, and just giving them that little TLC.
And I love being a nurse. It never gets old.
Work collaboratively with everyone, with administration, with physicians, with partnering with Trinity Health, and really taking Holy Cross to the next level, and I wouldn't want it any other way.
All the nurses are special, but I do bring compassion. I really love what I do, and I try to show that at the bedside and with all my patients and my colleagues too.
My dad got sick and he was in the hospital for 2 months, and I took care of him when he was there, and then I noticed the nurses of what they do, and I've just decided okay, I think that's what I'm going to do, help people, take care of them.
Every day it's a new challenge. You never know what you're going to walk into. And just being able to help out people is just amazing. You always got to be ready, refreshed, rested to help out the community.
I love working here. The staff, the managers, they make it perfect.
What I like is that I can help people and sort of contribute to my society, and it's part of my job. And at the end of the day, I go home and I feel good that I did something good for some people.
Well, when I was about 13, I had to perform CPR on my grandma, so that being able to revive her really gave me a nice satisfaction. So I just like taking care of people.
I just like to help patients and take care of them, get them healthy, send them home, keep them happy.
I feel like I've impacted or helped my colleagues as well as multiple patients, built good relationships with a lot of people that I've met along the way. So I feel like I've done my part in society by being a nurse.
I enjoy connecting with the patient personally, learning a little bit more about them outside of what their illness is. I like to connect with them and attend to every little need, be it big or small, be it medically or mentally, what is necessary.
I mean, sometimes it's sad, and sometimes I want to cry, but at the same time I have to keep reminding myself, no, I can't break down. I have to be strong. I have to be strong and make sure I do things the way it should be done for them right now and support them emotionally.
Each one of my patients, I see my mother in there. That's why I try to do my best for them, to care for them the best I can. Because I know if that's somebody's mother, somebody's father.
I do my best, especially when the patient's family members are calling. I do my best to answer all calls. But if I can't answer all the phone calls, I do my best to try to give them a call back, just to give them some type of comfort or reassurance that their family member is okay.
Believe that nurses have a sacred responsibility to not only teach patients in, yes, patient care, but also take care of each other and teach each other.
Throughout the rapidly evolving COVID-19 crisis, dedicated and resilient nurses are ensuring everyone has the care they need. No matter the day or circumstance, our nurses are there to make a difference.